Have you ever had one of those days where your voice just gives out, like it's strained or it's hoarse, and it just feels like you have lost a part of yourself? Well, it's quite frustrating, right? So today we are going to talk about the journey back to finding a clear and confident voice and the amazing set of experts who can get you there.
So now we will do the quick summary of our blog. What is vocal health? Vocal health means keeping our voice strong, clear and reliable for everyday life. It's not just a sound. Our voice is our identity and our connection to others. So what can we do to take care of our voice? So simple habits like long way, stay hydrated, rest your voice after heavy uses and avoid irritants like smoking or shouting.
So, what can go wrong? There are several disorders that can affect the voice. First is dysphonia, which is general voice disorder often caused by strain or misuse. Second is stuttering, which affects the flow of speech. Third is voice nodules and polyps, which are growths on the vocal cords due to overuse. And finally, fourth is laryngitis, which is usually inflammation from infection or strain. Now that we know what can go wrong, who can help you recover? Care is a team effort. ENT doctors treat medical causes with tools like laryngoscopy. Speech therapists then guide patients with exercise, breathing drills, and personalized strategies. Together, they help patients not just recover sound but regain confidence and communication.
But now one might wonder that why does it matter how your voice sounds or how your voice breaks or something like that. So losing your voice impacts work, school and especially your relationships. But restoring it means more than just sound. It brings back your confidence, connection and joy, and especially the freedom to talk anyone with people however you want. So now that we have understood the benefits of how voice is important and why it should be restored, let me show you some simple exercises which are often used in therapy, which helps you to keep your voice healthy, and it prevents any kind of voice or speech issues. So first we are going to have a look at laryngeal massage and myofascial release. So these are manual techniques which are used to release muscle tightness around the larynx and neck. So before performing these exercises, the first step which you should remember is that you do not have to hold breath during your entire exercise. Once you have remembered this point, second is that we will sit or stand with your spine straight. Then we will do basic warm up to relax the muscles. So we have to relax the muscles around neck. So exercises include sideways neck rotation, and spinning your head. So once you have performed these warm-up exercises for 1 minute, after that you should feel some relaxation in your neck muscles. After that you have to make sure that the chin is parallel to the floor. Once the chin is parallel to the floor, you have to locate for a bone called a hyoid bone. So you will have your Adam's apple somewhere over here, and you will have your chin over here. So between this chin and the hyoid bone, between this chin and the Adam's apple, you will have a hyoid bone which will be located somewhere here. So once you locate this hyoid bone, which is somewhere around here, you have to press your fingers, grab your fingers like this, and you have to extend it on the hyoid bone like this. Once you start extending your fingers, you will notice that there is something called as edge, which is the edge of the hyoid bone. You will feel like there is a jaw of a bone right here. So you have to locate those particular edges, which will be located somewhere here. So once you have located those edges of the hyoid bone, you have to gently start massaging it up and down and back and forth. After gently massaging it, you can also massage it in a circular way. Once you are done with the massaging, you have to do this for at least 2 minutes, because that will again help your larynx and it will make it better. Now, finally, to conclude this activity, you have to press your thumbs like this, and you have to locate the upper edge of that bone, and you have to rub it against the chin like this. Yes, so you have to rub this area. After doing that, you can conclude your exercise, and this is mainly used to treat dysophonia and laryngeal related chronic voice disease.
So now we have another exercise. This is maximum phonation time MPT, which is exercise done curing for polyps or nodules. Here you take a deep breath and sustain a sound and release it with a sound like E for as long as you can. So I'll show you the demo how I do it. So one thing that you have to remember is you have to create the sound from your vibrator here. You don't have to make the sound from your tongue. You have to make a sound like E, which strains your vocal cord and not your tongue. This helps for people that have polyps or nodules. This will help doctors and therapists measure how strong your vocal folds and check the level of severity of polyps and infection related to it is. Next we have is semi-occluded vocal tract exercise or SOVT, which is again an exercise for dysphonia. In this what we do is we go from a lower pitch to a higher pitch voice in a slow and systematic manner. I will show you a demo and you will understand it. So what this does is this reduces strain and improves vibration. SOVTs introduce a resistance to the upper airway which creates back pressure that helps to support the vocal cord.
So now the next exercise is lip fluttering or lip trills used for curing the stuttering problem. Lip fluttering is done like this. So like we can practice it like slow to fast, like or fast to slow, like we have to practice this few times a day. It's a great for relaxing, increasing airflow and making speech smoother, especially for the people who stutter. It also helps in improving the movement of articulator and resonators. So that's just a glimpse into vocal health, why it matters, what can go wrong, and some of the simple but powerful tools experts use to bring voice back to life. Remember, your voice is your identity. Take care of it and it will take care of you. So thank you.